Minister of Health and Long-Term Care. Speaker, Ontario is in the grips of an opioid crisis. Hundreds of families have lost loved ones and thousands struggle with addiction. Speaker, this government has been too slow in addressing the public health emergency we have before us. Now we know the sad results. This morning, the government attempted to bury the new opioid statistics in a news release. The release shows a 52% increase in opioid-related deaths and a 70% increase in ER visits from opioids year over year. Speaker, this government was slow to respond to the crisis, and it shows in the stats. Speaker, my question is to the minister. Since the former Minister of Health failed to timely respond to this crisis, will the new Minister of Health respond to this crisis in a more expedient manner?
Minister of Health, Long-Term Care.
Thank you, Mr. Speaker. And I think we should acknowledge that every life lost in this opioid crisis is an avoidable tragedy, and our government is committed and has been committed for some considerable time to doing everything in our power to combat this public health crisis. And so, of course, we are investing over $222 million over 3 years to combat this crisis here in Ontario. And we're going across the spectrum. We're expanding harm reduction services, hiring more frontline staff, and improving access to addiction supports across the province. In our news release this morning, Mr. Speaker, we, of course, stated the latest statistics from our Chief Coroner, and these are certainly most alarming. There were some 1,053 opioid-related deaths in Ontario from January to October 2017, compared with 694 during the same time period in 2016. This does represent a 52%.
Thank you. Supplementary.
Back to the Minister. Speaker, this crisis has been on the radar in Western Canada for years, yet this government chose not to take preventative measures to protect Ontarians from the dangers of opioids. Both the government and the previous health minister have clearly failed to properly address this crisis. Speaker, Global's Alan Carter notes that there is a significant lag time in reporting the data. Other jurisdictions, including BC, report much more recent data. Speaker, the government's reporting opioid death numbers are out of date and incomplete. My questions to the minister: can she explain why the numbers they provide are so out of date compared to other jurisdictions, and why there is such a lag time between reporting this crucial information?
Thank you, Minister of Health.
Mr. Speaker, and actually I really resent this particular allegation because it's absolutely not correct. I met with the Chief Coroner yesterday. Obviously, these statistics are extremely accurate, and indeed they are alarming, and that's precisely why my predecessor on October the 4th, 2017, announced the creation of a new opioid emergency task force chaired by the Chief Medical Officer of Health for Ontario. And they are meeting regularly. I also met with the Chief Medical Officer of Health. They are having a strategy that will address each component of this particular issue. It's very much wrapped up with our mental health and addiction strategy as well. Obviously, any opportunities to prevent the mental health issues that may potentially lead to addiction are extremely important. But we're also introducing overdose prevention sites, and the member opposite will start to see, I'm sure he's aware of the one that we opened in London recently. I just would like to question why on earth the members opposite were completely silent on supervised injection sites, harm reduction, and nothing in their platform on opioids.
New question.